Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Pharmacy Medicine, and today we'll start with thermal injuries. In thermal injuries, mainly we'll discuss with cold injuries. So, thermal injuries or thermal deaths, these are the injuries which results from effects of systemic or localized exposure to excessive heat or cold, that is extremes of temperature. So, whenever there is extreme of temperature, extreme of excessive heat or excessive cold, generalized effect of them or general localized effect of them leads to thermal injuries and ultimately death. So, coming to classification of thermal injuries, it can be classified into cold injuries or heat injuries. In cold injuries, again, general injuries and local injuries. General injuries mainly leads to the hypothermia, and local injuries in cold leads to frostbite or trench foot and immersion foot. In heat, general injuries includes heat cramps, heat prostrations, and heat hyperpyrexia. Localized heat injuries includes burns and scars. So today we will discuss about cold injuries. Coming to cold injury, mainly first is the generalized injury, that is the hypothermia. So hypothermia by definition, it is defined as an oral or exit temperature of less than 35 degrees centigrade. So whenever the normal body temperature decreases and becomes less than 35 degrees centigrade, that is considered as a hypothermia condition. So direct effect of cold is mainly prominently seen in fatty tissues and myelinated nerve fibers, where they directly affect the nerve fibers. Nerves have symptoms like tingling and numbness, and nerve cells starts dying. The indirect effect mainly because is seen as a ischemic effect, mainly because of vascular damage, where the the capillaries and blood vessels starts constricting. There is a vasoconstriction, which leads to ischemic changes in the tissues. Local direct effect mainly seen in the nerves, where they directly affect the decrease in temperature, directly affect the nerve tissues and fatty tissues, where they starts dying. Risk factors for hypothermia: first is lower environment temperature. If the temperature starts decreasing, it is one factor. Then extremes of age. So infants, children, adults, they are more prone for hypothermia. So even little cold can affect more compared to adults. Immersion in water, wet clothing. Wet clothing mainly causes, if the person wears wet clothing for prolonged period of time, may cause hypothermic conditions. If the person is having some pre-existing disease such as hypothyroidism, atherosclerosis, dementia, or inadequate nutrition, where there is decrease in the body fat, they all predispose to they all pose a risk for hypothermic conditions. The person is intoxicated, if the mainly because if the person drinks a lot of alcohol, which causes increased perspiration and it causes decreased body temperature, and if he is exposed to hypothermic condition, it may exaggerate the hypothermia. Persons engaged in activities like mountaineering or sailing, they are more prone for hypothermic condition if they are exposed to environmental condition where there is decrease in temperature. Clinical features of hypothermia can be divided into three stages. In first stage of when the body temperature decreases by less than 35 degrees centigrade, the person starts getting shivers, and where there is a cold and where there is shivering and body temperature falls. In the second stage, the shivering stops at about 32 degrees centigrade. Victims become depressed, lethargic, drowsy, and sleepy, and gradually pass into stupor and coma. So, as temperature decreases, the person becomes lethargic, is unable to have any activity, and later on he passes into sleep and coma. At third stage, when the body temperature decreases by 27 degrees centigrade, it, for which may be maintained for 24 hours, the person will be, which is fatal and person dies. So, mainly the temperature is mentioned here is core temperature, that is body temperature, not the environmental temperature. So when the core temperature of the body, that is oral and axillary temperature, reaches less than 27 degrees centigrade for more than 24 hours, it becomes fatal and person dies. Death results mainly because of ultimate failure of vital centers and due to anoxia. So the mainly it affects the brain tissue, where it affects the nerve tissue, where nerve dies because of decrease in temperature, direct effect. Indirectly, there is decrease in blood supply, Decrease in blood supply because of vasoconstriction leads to anoxia. Oxygen is unable to reach all the tissues and person dies because of that. There are different factors which may affect the cold injuries. As I mentioned, age. Adults are more able to bear cold better than the extreme age like infants and elderly. Duration of exposure there is longer the duration, the more severe the effects. Then bodily condition, if the person is already fatigued, exhausted, or intoxicated or starved, which has the cold injuries, effects of cold. Thyroid deficiency, if the person has some degree of thyroid deficiency, even clinically mixed edema, which predisposes low body temperature, may produce which exaggerates the hypothermia. Certain drugs like phenothiazine drugs predispose towards hypothermia. Complications of hypothermia. Patients who survive for short term may develop hemorrhagic pancreatitis, pneumonia, ulcers, focal hemorrhages in the GIT, acute tubular necrosis, and myocardial fiber necrosis. Mainly, again, these are all reasons because of decrease in oxygen to the tissues as well as increase in infection rate. So, because the body is becomes immunocompromised and there are chances of many infections, there is chance of hemorrhagic conditions in the GIT, and necrosis may be again because of decrease in oxygen to the kidneys. There may be necrotic conditions in heart and kidneys. Coming to postmortem findings, there is no particularly unique change in the postmortem findings, but certain changes like environmental changes if the person is found in the cold environment with decrease in body temperature, history of presence of history, all will confirm the diagnosis that person had died because of hypothermia. Typically, externally on the external body surface, there may be presence of patches of pink to brownish pink discoloration. There may be PM staining, which is present in the backside and different parts of the body will be pink to bright red due to antimatter binding of oxygen to hemoglobin. Extremities may be cyanosed or white because of decreased blood supply to the extremities. There may be edema of feet and blistering of the skin may be seen. Internally, blood is bright red in color. There may be frothy or sanguinary fluid in trachea. Lungs will be congested, edematous, and show hemorrhages. Mainly, these are all changes mainly are seen because of asphyxia condition, where there is decreasing oxygen to the tissues. Heart may be dilated, dilatation of right anterior ventricle may be dilated. There may be witch's skin spots may be seen in the stomach. Typically seen in hypothermia, that is blackish lesions are seen in the stomach, mainly because of decreased blood supply. Kidney, there is tubular necrosis with accumulation of lipid and epithelial cells and proximal renal tubules. In liver and spleen, they are congested, the fatty changes may be present. Muscles hemorrhages may be present, pancreas hemorrhages may be in pancreas and mucosa may be seen. In intestines, ulcerations of colon and ileum and hemorrhages after infection of colon may be seen. These are all findings related to hypothermia. Now coming to localized effects of cold, it may lead to chilblain, trench foot, immersion foot, and frostbite conditions. Chilblain is a condition which is also known as erythema perennial. In this condition, there is red, itchy skin lesions are present because usually in the extremities caused due to exposure to cold. They may be associated with edema and blistering and aggravated by warmth. On continued exposure of cold, ulcerated and hemorrhagic lesions may be developed. So these are seen in a localized area of the body where localized cold is applied and which leads to blistering and skin lesions. Treatment, elevation of the affected part and allowing it to warm gradually at room temperature. So that part which is cold temperature has to be raised. This area should not be rubbed or massaged, only it should be made to come into room temperature. Next localized effect is the immersion foot or trench foot. Immersion foot or hand or foot results from prolonged exposure to severe cold which is less than 10 degrees centigrade. It is usually 5 to 8 degrees centigrade. This condition is seen, and dampness seen in soldiers during warfare, mainly seen when the person is immersed or have wet clothing. If the person is wears a wet clothing or he is prolongedly swimming or prolongedly exposed to dampness, like when the soldiers are working in the forest areas, they are continuously exposed to water vapors, and the clothes are continuously wet. That causes the immersion foot or hand. Extremities are usually affected in these conditions compared to other part. So since the extremities have lesser blood supply, these are the affected parts. Clinically, it is divided into pre-hyperemic, hyperemic, and post-hyperemic stage. In pre-hyperemic stage, the affected parts are cold and anesthetic, so there is no sensation present. In hyperemic stage, the parts becomes hot with intense burning and shooting pains. Later on, they become pale and cyanotic with diminished pulsation. So first there is decreased sensation because of dying of nerves. Later on, there is burning sensation. Late they become cyanosed, and with the decrease in blood supply, it becomes pale. Treatment: air drying, mainly protecting the extremities from trauma and secondary infections, and gradual rewarming by exposure to air at room temperature without massaging or moistening the skin or immersing it in water. So you should keep in mind the part should never be massaged. The part should be rewarmed to air room temperature slowly without any applying any water or any skin rubbing. It has to be allowed naturally to come into room temperature. Next localized effect is a frostbite. This is extreme form of localized effect. This results injury due to freezing and formation of ice crystals and obstruction of blood tissue supply within the tissues. So decrease in complete stoppage of blood supply to the extremities may lead to frostbite, where the tissue undergoes necrosis and gangrene formation may also get amputated. It occurs mainly due to exposure to great extremes of cold, which is less than 2.5 degrees centigrade. If there's extremely extreme cold condition, it is frostbite is seen. This typically evident as blue-black discoloration of fingers, toes, or other susceptible parts of the such as nose, ears, and face. So these are the areas where the blood vessels are smaller and fewer in number, and these are the areas are commonly affected in frostbite, like fingers, toes, nose, ears, and face. In mild cases, only the skin and subcutaneous tissues are involved, and symptoms are numbness and prickling and itching. Deep fried frostbite involves deeper structures, and there may be paresthesia and stiffness may also present. Thawing causes tenderness and burning pain. Typical features of frostbite is if the person's temperature is increased, it causes tenderness and burning pain. The skin is white or yellow in color, loses its elasticity and becomes immobile. There is edema formation, blister formation, necrosis, and gangrene. So first the skin becomes white to yellow, loses elasticity. There is edema, blister formation, necrosis, then gangrene formation, and beyond that, and it may get also amputated. Frostbite is only produced during life and cannot be seen in postmortem. So this is very important part which has to be seen. If there is a frostbite seen, that indicates that the person was alive, since it requires a running blood supply for frostbite to occur. If there is the person, it cannot be produced postmortem. Treatment for frostbite: first is rewarming. For superficial frostbite, it is also known as frost nip. Firm steady pressure is applied with warm hand. So steady pressure has to be applied. So it should not be rubbed. Without rubbing, steady pressure should be applied. It can be done by placing the fingers in armpits. Commonly you can do it. So if you place the fingers in the armpit and steadily apply pressure, the warmth can cause the increase the temperature. Then protection of the part. So pressure of friction is avoided and physical therapy is conducted in early stages. The extreme parts has to be protected. Then later on, any anti-infective measures has to be taken, like tetanus, antibiotics for deep infection has to be given. Medical importance of cold injuries. Suicide by exposing to cold is very unlikely. Accidental is commonly seen, where the person may be alcoholic or may fall asleep in even in the snow, or a person lost in snow drifts may die because of hypothermia condition. Homicide mainly seen because in unwanted infants, since infants cannot maintain cold temperature even when they are left in the night, even the temperature is slightly more also, since the temperature decreases, they cannot maintain the body temperature cannot be maintained and you not usually get exposed to hypothermia condition. So mainly seen to getting rid of unwanted newborn babies or elderly people. Then there is paradoxical undressing and hide and die syndrome. These are the features which are commonly mistaken for sexual offense. So paradoxical undressing is a condition, a stage condition which is seen many times in hypothermia, where the person takes off some or all of their clothing. In this condition, the victim becomes disoriented, confused, and combative, and may begin discharging the clothes he or she be wearing, which in turn increases the temperature loss and the person goes in hypothermia and dies. So as temperature decreases, the person becomes disoriented and may start certain times may start undressing, which is called as paradoxical undressing. This sometimes may be assumed as death because of sexual offense, which has to be clearly seen and environmental finding has to be taken in account. Next type of uh, importance is hide and die syndrome. In some cases of hypothermic death, the person may be disoriented, dying, or hypothermia victim. Sometimes attempt to protect himself from cold, may hide himself in corners, in cupboards, or under piles of furniture or household goods. So in this condition, when the increase in cold, the person may becomes disoriented and may start trying to hide in certain places like under the cupboard, under the bed, or he may break the furniture and try to hide inside them. This may all be assumed as a homicide or robbery case, but has to be again the environmental condition has to be taken in mind. These are my references. Thank you.